And then I know some people will be straggling in. I am Sharpelle. I am not Nina Marie. Nina's traveling. And so I'm going to try to host the meeting for her on her behalf today. So if you were here last time, we had an awesome, impactful discussion about healthcare. We'll do the same today with a different speaker. But first, let's get uncomfortable, shall we? Again, I said my name is Sharpelle. If we can go around the room so that we'll know who you are and what organization you represent, and then we'll get started with our activity. I'm with Community Renewal, and you are?
Diana Thomas. I work for Louisiana Association on Compulsive Gambling. I'm the 988 Education and Outreach Coordinator.
Oh, nice. Association for Compulsive Gambling.
I'm Robert Odom, Program Assistant, and we have 3 initiatives at Community Renewal. One of them is Friendship House, another one is Haven House, and the other one is Renewal Team.
Introduce the organization, Robert. I love it. Yes, sir. Good job.
Wade Samuel, Community Renewal.
Over here.
I'm Bradley Harmon. I'm Vice President of Mission Integration for Christus Health in Northern Louisiana.
Yes, and I'm David McCarter, and I'm also with Community Renewal.
I'm Nancy McCarter, and I'm on the Board of Catholic Charities, and I'm also with the Shreveport Opera.
Precious Lynn, I'm with Start Corp's Regional Recovery Hub.
Keisha Newsom, I'm with Coordinating Development Corporation. We do workforce development grants.
J.D. Titlow, I am also with Community Renewal. I'm with the Community Coordinator.
Hi, I'm Jayla Rollins. I work with the Trio EOC, and our main goal is to help high school seniors and adults get into higher education.
Corey Hammond, I'm Director of Trio EOC. I work with Jayla.
I'm April Sylvie. I'm with Star Corporation's Regional Recovery Hub.
I'm Trina Washington. I'm with Mary Lee.
And if you were not here last week, Trina took us to church.
Yeah, absolutely.
She had me reconsidering my entire life choices based on how we treat those who need, who have a mental health need. It was so awesome. It was very impactful. I laid at each of your tables a sheet that looks like this. It's a question prompt. I want you to dig deep into your consciousness and imagine that Shreveport metro area healthcare systems would shift from prioritizing treating illness to prioritizing preventing those illnesses, right? If everything we did was geared toward, well, if most of what we did in this area was geared towards people not getting sick, what types of communities would we have? How would that affect, say, safety? How would that affect relationships or leadership or education? Imagine a community where we poured the lion's share of our efforts, our healthcare efforts, into prevention rather than curing illnesses or treating illnesses. Imagine what that would look like. I want you to take the card stock on your table and draw a picture of that community. I want you to nominate and elect a scribe at your table who would take that page with the question prompt and describe in words that community. So everybody will draw. One person will scribe. Does that make sense?
You want some color crayons rather than that? How do you draw a community?
I don't know.
Lots of houses.
Setting, you've got groups of people, less isolation, company. And when you're not isolated when you're in groups of people and when you're with company, there might be someone that identifies maybe some health crisis in you that can be shared through conversation and through just companionship. We also talked about school. It really is important to remove this stigma of mental health in schools. So mental health is something that is just as easy to talk about as physical health, so that it becomes normal, and it's becoming more normal, but we have a long way to go. We're becoming more, normal for our kids to go to school and talk about mental health and talk about things that's wrong with them and the boo-boo on their brain, and that it's not shocking, or that we have understanding, acceptance, awareness, but we also have guidance. So when these children feel comfortable talking about mental health, that not only are they getting the understanding, but they're getting the guidance, and that would lead at an early age to a healthier mind. We also talked about city planning, which kind of goes also into the picture of people in the park. Not only parks, but a city that's set up for less cars walking more, narrower streets, bike trails, and how maybe there could be a partnership between governments and nonprofits. I'm not going to be able to go ahead and change an entire city, but maybe there are aspects of it that could change. Next is helping hands. Emotionally, like there are some chemical imbalances that need probably medication, but there are some imbalances that I think that emotions can help correct. So if we're all in the same team and we're all on the same page and we're emotionally helping those, I think that it could go a long way. And along with that emotional aspect of it is that we see, if you and your child or you and your friend or adults and children are modeling that emotional, healthy relationship, then more people can mimic it. And we believe in each one teach one, which is it works both ways between a child and an adult. The arrow goes both ways. Children can learn from adults, and adults can certainly learn from children. And then the next one is the parent-child relationship, where parents need to be aware of mental health issues and children act out instead of being angry or being mean or dishing out punishments, that the parent would be more likely to say, sit down, let's tell me what's wrong, and the parent have a more of understanding, and a parent have more understanding and positive communication, rather than just it's just one way, it's my way or the highway, but start having more conversations between the parents and the children in terms of patience for the child that might be suffering. So that's what our preventive scenario looks like.
Let me tell you something. If I don't see Nancy's name on a ballot in the next local election cycle, I'm going to be very upset because this lady talks my language. So did you know that statistics show that if you want somebody to really believe what you're talking about, preface it with statistics show? Yeah. No, but really, that happened. There have been studies talking about the social determinants of health, and for community renewal in particular, that's very near and dear to our heart. Nancy touched on it a little bit. When you are socially connected and positive, mutually enhancing relationships, you are healthier. Yep. Imagine that. Imagine if people were more, the more people connect, the healthier our society will be. And we have a speaker that's going to, I'm sure he's going to touch on it. He's the expert. But yeah, she touched on all of that. And so that's pretty cool, pretty cool. But statistics really do show. Who's next?
Hi, everybody. So our community would be the Red River, as you know, is red. So it more cleaned up. So the community gardens can grow and thrive, and preventatively we can eat healthier, we are more healthier, and also having more like basic walking communities or walking trails like other big cities do, just so people can be more active and as we said, as a family do things as well, having more gardens as well. Also speaking to the unhoused community, making areas better and cleaner for them, and helping them more as well with kind of help in general. starting with the family unit, having both parents in the house, supporting their children, things like that. Schools being well staffed, healthcare, needs to be a priority as well.
Yes.
Granted, we want to prevent it from people being in hospitals, but as well as teaching and things like that. And focusing on worship. That's kind of what we all talk about.
Look at this mess right here. She didn't tell us she was an artist. Go ahead, Jamie.
I wanted to touch on something really important that you were talking about, Nancy, was the mental health thing. And it came to me while you were talking, so I didn't get a chance to share this part, but something that I've been really thinking on and praying on is that I really feel like along with healthcare benefits that we're trying to make more accessible, along with that, I think a lot of adults in our community would really benefit from having easier access to therapy and trauma counseling, because I had a conversation with a parent yesterday who is wanting to bring all of her children are on parent return for fun, meaning that their children have been suspended so many times that it's going to be really hard to come back. But we haven't been able to sit down and talk with this mother the entire time we've had our babies in club. And so we scheduled a parent meeting because the boys really wanted to come back, but there had to be a lot to talk about before that conversation could happen. And, in this conversation we were having, realizing all the trauma that she never worked through before she started having her babies. And now her babies are in the same trauma cycle that she was in, and she was actively admitting, like, I'm working on myself while I'm trying to work on them, but I don't know how to do this, and I know I'm not doing it right, but I'm trying. And I was just like, man, we're so focused on these kids, but these parents need so much help. We're trying to help her kids regulate their emotions. We're trying to help their kids to talk through these things and to find better solutions when your anger issues go from 0 to 100, but mom needs help, but she doesn't know where to go, who to reach out to. There's not a program for her to go, and so, that's something that's really been on my heart is therapy and trauma counseling.
So when we talk about health, we're not just talking about a broken leg. We're talking about a broken heart as well. Broken systems. So it all ties in. I am convinced that a lot of the parents in our communities who are struggling the most are trying. You ever try to hammer a nail with a screwdriver? Wrong tool, right? And as we intentionally give them more tools, they don't want to be bad. Nobody wants to be bad at anything, right? So they're using the tools that they have.
Yes.
And it's up to us who know better to reach somebody who doesn't know and pull them along.
Thank you,
Awesome,
Jamie.
awesome. One more table and then we're gonna eat. My stomach is growling. You got it.
We had a good conversation about this shift from treating illness to prevention and community well-being, and it could maybe be summed up best by our focused conversation on what is a walkable neighborhood. And one that I think was the last one added, but maybe the place to start, is a community investing in itself, which requires us to think differently than we currently think. And we talked about a walkable community and being accessible to a neighborhood park, not a regional park, something we can walk to, and that there's a community garden, that the schools are close by, but schools are focused on local healthy food, not on processed food that travels 2,500 miles to the plate, and that being walkable means that we can walk to shop, that we're organizing our city where we really, truly don't need to drive everywhere that we go. And that there would also be more community health centers, more resource fairs in community health. And I think I covered, did I leave anything out? Okay. And we've got some drawings of community over here. So.
Each of these communities are absolutely wonderful. I believe we have loaded Bradley's quiver for his address to us today. He must be Baptist because I heard all those church sounds coming from us. This was the amen corner we were talking. Okay, what we're going to do now is get up, grab something to eat, enjoy your lunch that Nia has arranged for you today. And just as we're finishing up our lunch, we'll hear from our guest speaker. We are here to connect and find out what we can do together and how we can support each other. I'm going to bring up, well, he's already up, but I'm going to introduce you to Mr. Bradley Harmon. I love his last name. My mother was a Harmon. Her married name was a Harmon, so don't let me find out that Papa was a Rolling Stone. Bradley Harmon is the VP of Mission Integration for Christus Health, and he'll be addressing us about health care.
It's great to be with you all. Please finish your lunch while I talk. I was up at our warehouse today, and I drove past St. Vincent Street, and I thought of St. Vincent de Paul, who in the 17th century told his sisters, who were cloistered then, they were cloistered where they didn't engage with the public. And he was walking through the streets and just seeing the poverty, seeing the challenges. And he went back to the sisters and he said, I want your cloister to be the streets of Paris. And he challenged them to leave their cloister and go out. And that's what they did. And so when you see so many of these Catholic hospitals, it comes from that one call. And he had this incredible quote that said, go to the poor and you'll find God. Like that was his challenge, right? And so that's something that the sisters still say to us. Like she's like, Bradley, go to the units and you'll find God, right? So this is truly a mission-based organization, Christus. And I'm here just to share with you just a little bit about philosophy in our limited time, and then I'm going to talk about praxis, right? So there's like what we believe, why we believe it, and then we're going to talk about like how we apply it, what the praxis looks like, right? So the sisters never, back in the day when they were running Shumpert, they never used the word health equity. That wasn't a word that you would find them talking about. But they did talk about going, basically serving the most vulnerable in the community. And so, and they truly believed these two core concepts and that are still alive in our culture today. And one of them, it comes from Matthew 25. You may know it. It's about the sheep and the goats, right? So, there's so many people. You just go on TikTok or wherever you want to go, talking about how you get saved and how, what's the process, right? Catholics are a little different, and Matthew 25 is a big part of our ethos, right? And it was a big part of our sisters here. And Matthew 25, what's the separation? What separates the sheep from the goats, right? And for all of you who know it, right? It was like, when did we see you sick? When did we see you poor? When did we see you a stranger? When did we see you in prison? And our founders really believed that, right? They're like, when God said, when you did it for the least of me, you weren't just doing it. I wasn't just, around it. I was one of them. You know what I mean? And so our founders took that seriously. They literally believed they would write about it. She would say, dear sisters, when you're cleaning the floors, you may be cleaning the floor of Christ. Right? So that's one. The second one is Imago Dei. Does anybody know? It's an old Latin term, it's 2,000 years old. Imago Dei. Anybody know what it means, the Latin? It means image of God.
Yeah, God.
Image of God, we had it. All right. And it's a concept that comes from first chapter of Genesis, verse 27, which is, and this is just paraphrase, but it's, in the image of God I created them male and female, right? And so the concept is, when Catholics talk about the sacredness of all life, right, it is from that Imago Dei scripture passage, right, which is everyone, and at orientation, I get people to stand up and I'm like, look at every single face, because it comes from the mind of God. Every single face comes from the imagination of God. No two twins have the same signature. And so all life is sacred, all life is to be protected. So those are the two fundamental core concepts. And I would I would say, because I'm going to challenge you in a little bit. But I would say to this, because this is a big group of community renewal folks, I know for sure, is that there's some overlap here in what you all do, in your vision of the world, which I find truly inspiring as well as do a lot of other people, right? There's an overlap about how you see the world, right? And it's very incarnationally, right? So our sisters were the incarnate word, right? Which was this concept, because there's some Christian groups throughout the centuries who have said, matter's bad, the world is bad, and we got to escape it, and we got to get into the by and by, and can't wait to go. You know what I mean? And then there's another group of strand of Christianity, which is the Orthodox side, which is the incarnational side, which is because of God becoming flesh, all matter has been transformed, and that's the world we live in. And so when we go into these communities, sometimes you got to kind of cut through that a little bit to get to that image, but it's there, and you have faith that it's there in every single person in those neighborhoods. And so that's when I see you guys operationalizing the incarnational mentality. It's very inspiring, right? And so that's what I see you doing, and I see there's an overlap, with what the sisters did all those years ago. So that's that belief that inherently there's good in all of us, right? And when we got to stop just believing the news. You know what I mean? Because the news makes money on us separating each other. They make money on getting us to be afraid of each other. You know what I mean? And so, but you guys have just set an incredible representation of what can be an incredible practice. I mean, in the world, in my opinion. Okay. So just now I'll get down to the practice, right? So you've got you got your belief, how do you live it out? And I'm just going to talk about what we do, right? So we have the CHNA, which is the Community Health Needs Assessment. It is a very it's a tome, right? And every 3 years, and I'll pass this around, it is a tome, but every 3 years we will dive into the statistics of Northwest Louisiana. We will get government data, city data. We will gather groups like this and do focus groups. But what we're trying to get at is, okay, so where's the next thing? What do we need to be focusing on as a healthcare community of Christus? And so this was done 3 years ago, and I'm going to pass this around just so you can kind of get an idea of the statistics that we find. And what we found in our last round was that some interesting data, and we found that we have we have the highest diabetes rates in the system of Christus, and we have the highest diabetes rate in the state, right? And so, okay, what's that about, right? And so we also found that we have some of the highest heart disease, and so what's that about, right? And so we were kind of delving in, and it can be overwhelming. I'm going to pass this around. You're just going to see this is overwhelming, right? If you just go,
this region, the city.
Say again.
Who's the we?
When I say we, it's my community benefit team at Christus, and I'm working with the system office, close. So it's system and then local.
Yes.
Yeah.
Geographically, that entails what?
Geographically, it entails all the counties in Northwest Louisiana, and they're listed in here. I wish I had more of these, and thank you for stopping me, because this is what I'm here to do, right? So, because I'm just going to go through this, but stop me. So it can be overwhelming. What do we do? Because we only have limited resources, right? So what do we do, right? And so for us, it was then looking at, and I think an aha moment for us was, okay, what is some of the common denominators to all these comorbidities that we're seeing? And our CEO was really kind of leading this of our region, and he said we need to move the needle and we need to have a focus, right? And so what we did was we looked at a couple of things. We want to move the needle on cardiovascular because of the heart disease that's rampant in our communities, and the second one was food. And that to me was like that. If you just look at these comorbidities, and I'll start with you. You can just pass this around. If you just look at the comorbidities, like food, and so I was just like, yeah, I was doing the church. I almost did an amen, right? Because what we found, and so when I go visit rooms, like I visit patients, you know, and you walk in, and I'm just telling you, you walk in and you go, you look at the chart, and you go, well, no wonder. Like, just no wonder. Like, there are things you can just predict by lifestyle, by, you know what I mean? By not really taking care of oneself, by not eating the right foods. Like, food is medicine. That's another thing we as a community got to realize, that food is medicine. You go to some of these countries like Japan. I'm going to go down a rabbit hole here. I gotta stop. I only have so much time. But we don't regulate our food, and it's hurting us. I'm just telling you. It's the Wild West when you compare it to these other countries that have much healthier citizenship. I mean, drastically healthier citizens, right? That's a whole nother. You get another speaker for that one. But the point is that it can be overwhelming, okay? But when you point to like just making people walk more, if you look at these what are they? The blue zones or whatever, like these, is that what they call them? I've only touched on that a little bit. I've just been reading other data, but just you can create a systematic way to make people walk more, and yet we fight it every chance we get. We actually have road rage because somebody got our parking spot at Walmart. You know what I mean? Like we're thinking about this wrong. We're totally thinking about it wrong. We need to systematically work together to see what we can do to make us walk more. Just that, walk more. You know what I mean? And what's fantastic, what's fascinating is like, I hate narrow streets. I'm always like, God, they're dangerous. I don't like them when these cars are getting too close to me. You know what I mean? But literally, these towns that have, there's data out there now. Like these towns that have created smaller streets are creating healthier citizens because the cars are forced to park. They're forced to park farther away, and it creates these environments where people have to walk. You got to read it. It's just it's fascinating. But so I would just challenge y'all that what you guys are doing is just an incredible thing. And I didn't intention. So we have 5 partners. We have Shreveport Green Impact Partner. We have Community Renewal. We have the Food Bank. We have the St. Luke's Band, and we have CADA, which is the Council on Alcohol and Addiction, right? Alcohol and what's the
Drug addiction.
Drug addiction, yeah. And they're doing some incredible interventions for us, right? And so I intentionally you were there where I put our 5 partners together, and it was kind of this intentionality, which is, because I loved the question you asked, right? Because that's the question we need to be asking. And because as hospital systems, this is how we all feel. Like we're literally like, we're putting Band-Aids on all this stuff when upstream prevention is the real answer. You know what I mean? All our money as a society, if you just look at what we pay in for taxes, I see it right now. It's end life. It's end life. We pour so much money into keeping somebody alive when if you could wake them up and say, what do you want to do? They would just, oh my God, just put me in hospice. Put me comfort med. You know what I mean? We are putting in all this medical attention so much later when we could use these funds way upstream into prevention. And so I just want to challenge y'all to just think about this, is that you got this incredible thing going with community renewal, right? But what can you focus on? I mean, it can be overwhelming, but what's one thing that we can partner with Shreveport Green on to create more green space in our neighborhoods, with our friendship houses, to model. Somebody used that word model, to model better living. So just start small. I think that's the next step for us. I think you asked the right question, which is like, what can we do for prevention? And there's so many things we can do systematically, politically, but what can you do in your in this moment in time as an organization, or whatever organization you represent, to partner to prevent. I think I wasn't even going to talk about that, but you guys, that was a part of the conversation. So thank you for that. I just want to finish with what we do at the hospital is just so you know, because it was mentioned about the social determinants of health. So I started a health equity committee, and we have these dashboards that we just started looking at about 6-7 months ago. And on those dashboards was our screening rates for social determinants of health, which is safety, transportation, utilities, food, and there's a fifth one that I'm always going to forget, but it'll come to me. What is it?
It depends on what y'all are tracking.
Which one? So there's another one we're tracking.
There's like housing, social connectedness. There's like there's like your access to internet.
Oh, yeah, we're not tracking that one. That's the one we don't. Yeah, people don't have it.
Economic climate.
Yeah. So what we track these 5. I got 4 of the 5, and when we tracked them, we noticed that we were only like 48%, and so we went to the nursing leadership and just hardwired it in, and we raised that 30 points in 3 months. And so but the nurses were awesome because they're like, okay, if you're going to make us do this work, are you really going to give them resources? Right. And so they called us out on the carpet, and so that's exactly what we had to demonstrate to them, right? So our caseworkers and our community health workers will go in after a positive screening for like food, and they'll walk in and start talking about different points of access for food. And we've partnered with Shreveport Green is that every time somebody has a flags for food disparities, they actually get sent to Shreveport Green, and Shreveport Green will deliver a bag of fresh produce, local produce, twice a month with healthy instructions on how to cook. It's not saving the world, but it's a good start. It's a good start, and I'm going to be really excited to see, like, do we reduce the readmission rates? In their exit survey, do they talk about eating healthier and having that more close to mind? So in our own way, we're doing something, but I do think you're right. Like, it is about the partnerships, in the community, and we're stronger together. And what does that look like? So that really is that's my talk. Any questions? Any thoughts? You guys were great, like, to just jump in through this. So
I do have one. The screening is happening for people coming in, like being admitted to the hospital?
What's the question?
Does that the SDOH screening, that's happening for patients being admitted?
So yeah, when they get admitted, they get an SDOH screening. Yeah, and right now we're doing it for inpatient, and our next plan is to do it for the ED admissions. So it's and what I get really interested in is, like, what is it going to teach us? Because I got to work with my CHWs, which are community health workers, because they're just like, go save the world. You're going to meet a couple of them, trust me, because they're incredible. But you got to, like, temper them because they realize the lack of resources. We're talking about mental health. That's one of the most lacking things in our community. So you got to, and the way I kind of flip it to them is I just say, but we're going to learn. And we have people that we have lobbyists that we can say, okay, this is what we need. This is what we've been determining from doing these screenings that our patients aren't finding. So work with the politicians, and then we can also work on our end with the impact partners. But it's kind of just getting them to see that it's not a perfect world. All the resources aren't there, but it's better to do something than nothing.
One more.
Yeah.
Sorry. Is this online somewhere? The report?
Is it what?
Is it online somewhere?
Oh, it is. Yeah. Thank you. That's a great question. I'll send you a link.
Okay.
Yeah, it's public. We make it public. Yeah.
Okay.
I'd hate to do all that work and like just let it collect dust. So. And I'll be curious to see what changes in this report. Thank you all.
Excellent. So the question that wasn't that awesome? Mm-hmm. And I could have wound him up and let him go another 45 minutes. I love your energy. The question that we started our time together with was not written by me. Thank you for the compliment. I'll take it, but it's not mine to keep. It belongs to Mr. Kim Mitchell. You have on your table a flyer that looks like this.
very important flyer.
That looks like this. We are starting what we are calling right now Neighborhood app. It's for all of our Circle of Caring members. If you have not, please take this with you. Use the instructions on this paper to download that app and engage in the questions. The question that we tackled today was our question for the month on the Neighborhood app. Let's keep the conversation going. Next month, I believe we will be talking about affordable housing, so we will touch on your areas of concern between now and December, I promise you. Every month is a different discussion. So let's keep the conversation going. Go to the app, answer the question, give us your thoughts on what that will look like, and hopefully what will come out of this is a way that we can determine that we can connect with those who are doing the work. If there is nothing happening, create the work, but we can tackle the work together and make our city a better place, our region a better place. Any announcements before we close out? What do you have going on that we can connect with you on or help you with or support you in?
So the Regional Recovery Hub is going to have our first ever citywide recovery event on September 27th. It's Recovery in the Park. We'll be acknowledging some of our amazing community partners, of course, as well as honoring our clients who have really made strides in their sobriety and staying sober, and just the programs and agencies that are helping us keep them on that path, getting back into employment, standing on their own, signing their first leases for the first time, and reuniting with their children. So we want to make sure that recovery, taking that stigma off of the recovery, community, and just showing our city that recovery is possible, and showing our clients that recovery can be fun.
I live for the day when we can talk about struggles with recovery or mental health, just like we talk about, girl, I got a headache today. Where there's no stigma, there's nothing's taboo, because if it's broken, let's get it fixed. So the wonderful thing about the app is that announcement that Precious just made, she can send that right to Miss Rebecca. Everybody in this room will go on that app and we'll see that announcement right on that app. You can RSVP for things that needs an RSVP. You can get your calendar to get downloaded to your calendar right from the app. So go to the app. Anybody else have anything coming up where we can support you?
I have a goal to enroll 10 out-of-school youth from the ages of 18 to 24 in work experience opportunities. Right now, I have a company looking for a welder. These need to be individuals who've had limited work experience. And our company, using the workforce grant from the federal government, we pay their salary in full for 6 months. Awesome. These individuals need to live outside the city limits of Shreveport.
18 to 24, these are your people. So at this table, they run the Educational Opportunity Center. And so post-high school age, to place them in places where we need to go, that's awesome. So you're trying to place 10.
That's my goal. More than that would be great.
Put it on the app, put that announcement on the app. We'll get that information out to all of our community coordinators who deal with the public directly. I'm sure we can find you 10 times 10. Anybody else? Who else?
Yeah, I have a question for you. Do you guys pay for the training for that individual?
So for that program, it's just work experience, so it's not exactly like on-the-job training. It can be any kind of work experience. Like I have a kid who's just doing filing for one of our local municipalities. I have another kid, he's actually doing a work experience for water and sewer, and once he's completed with that, we're going to roll him over to an apprenticeship program so that he can get certified. But the actual work experience for 6 months does not have to be trade related. It can be just working in a grocery store. If I had a grocery store who wanted to take one of our participants. Any of you business owners, if you need
But you got, your program is related then with that employer and then take the salary.
Yes, I find a match for them and we cover their salary for 6 months. We pay it before we cover the workers' comp, the unemployment, insurance. Yes, ma'am.
You said that salary, what would that look like?
I try to do at least $10 an hour, but we tell the employer to set the wage at something similar to what they would pay if they hired the individual off the street.
So the employee could say 16 and then you all
They
pay
sure
the
could.
16?
The more the better, because we have money to burn, or we gotta give it back.
Girl, we're not burning money.
We did not spend enough last year. And so if we don't spend it this program year, which ends in July of next year, we could have a problem.
Okay.
I'm being serious.
That's a problem that should be solved in this room, like today.
You have
Like,
any
we have a
flyers?
CC right here.
I do not, but I have plenty of business cards with me. And if you email me, then I can send you some.
What's the ages again?
Well, legally it's 16 to 24, but because we're having to focus on out-of-school youth for the majority, because we don't have a waiver anymore to do the in-school youth, I say 18 because typically by then they're out of school. But if they are out of school, they have to have a barrier. They have to be pregnant, parenting, aged out of foster care, or currently in foster care, have issues with the legal system, have maybe had a 504 IEP plan at the school, which shows that they have a disability.
So the father could disqualify? Like if he's a father, 19-year-old father?
Yes, that's an automatic qualifier.
So weren't those restrictions for the 16 to 18-year-olds? Or is that for all of them?
The disability, we call it a disability or a barrier, that's for 18 to 24, 16 to 24 if they're out of school.
Okay.
Income does not matter. If they're in school, it's a whole different thing, but I can't even focus on in-school kids right now.
Yeah.
Like, for an example, over the summer, I got 6 kids in school, because at the time we had a waiver. I got 6 kids work experience opportunities for the summer, and they made $10 to $12 an hour.
Wow. Do you think someone can do a flyer? Because if you have a
We
flyer.
do have flyers, I just did not bring them.
Just email me, Keisha, and we'll get it uploaded, and we can have Rebecca send it out to everybody in this room right now, and we can help you spend. I love helping people spend money, that's not mine. I love it.
And I love to break above my goals. The goal set for me was 9, so I set a personal goal of 10, but if I could top that, it would be amazing.
Yes, we're not burning no money today. All right, anybody else have anything coming up? On your table, you'll see RSVP card for the 30th anniversary. Community Renewal is 30 years old, y'all.
Wow.
We are having the ambassador from Mexico as our keynote speaker. Come have dinner with us. Dress up, get fancy, look pretty, brush your teeth, and let's eat. Dr. Russell.
Jess, we're going to get it on the app and instruct our ladies to use it next week. Citizens United, for those that socialize and don't know about that model. It's just 5 guys pressing forward citywide, community-wide to get at violent crime. But in order to do that, they found out that they're going to have to rebuild the whole village. If you're going to get at violent crime, you have to be healthcare, education, and all the wonderful things that Community Renewal works with. But Thursday we have a meeting. We're getting ready to have a festival in Moortown, I believe,
Yes.
on the 29th. But we have a meeting on Thursday, Louisiana Technical College at 11:30 for those that want to learn more and want to be a part of it. It's one of those great movements. And we're going to make sure it's on the app. And we're also I'm the director of Haven House, is where we're remaking the city by making friends on our street, because we feel it's going to have a level of health care, we're going to have a level of friendship, partnership, and relationship. We have to get to know our neighbors, and we have to be the change that we want to see. So we work on the block, where we do have a fun seminar on Friday. You know, it's early. I'll feed you if you come. But 11:30
Shreveport
is
citizens
1
will
o'clock.
feed you too on Thursday. We
At
have
Community
lunch.
Renewal, 838 Marketplace.
And I promise you, it won't be pasta with heavy.
It won't be.
We won't do that.
Be healthy for him.
Yes.
But we have a fun time. Just
All the bad stuff
Can't
is.
take the joy out of it.
Anybody else? Any announcements? What can we support you with? Corey?
Yeah. Well, we're literally 2 blocks away at the Metro Center for Southern University at Shreveport. So our organization, we are part of the Department of Education, and our goal is to help adults, so 18 to 99, we like to say, to secondary, some type of secondary education. So we start with the HiSET. We actually are partnering with Community Renewal to have HiSET at our location. We are packed out right now. I am paying for all the actual HiSET testing, so no one has to come out of cost to get their high school diploma. And then after that, the goal is to try to get them into some secondary type of education, whether that's a 6 month, 1 year, and it doesn't have to be anything tied with Southern. Since we work for the Department of Education, but we're housed at Southern, that means we can look at any education opportunity in the city, in the state, any program like what you were mentioning.
We can pay for that as well,
For
schooling.
Okay, awesome. So our primary age group is like, we're trying to make our participants a little bit younger, because we know once they maybe got off track, it'll be a little easier to get back on track when they're between that 18 to 24 range. So that's actually the perfect kind of age group that we are actually trying to get for our program, but we'll help and support anyone from 18 on up. So we'll be in the high schools this year, kind of connecting with some of the seniors as they are transitioning, and then anyone else. So again, we're literally 2 blocks right across the street from the Robinson Theater, and all of our services are free as well. So we will do advisement on education, on grants versus loans, trying to find other financial avenues to make sure that people are coming out of school debt-free and not getting themselves into trouble with some of the pitfalls of education. So that is the big picture of our program. I think Jayla has our digital card, or her digital card that she can share with everyone. But we'll try to get everything on the app as well. But
Absolutely.
That's our awesome
610 Texas Street,
Yes.
the Southern University Metro Center, where the Educational Opportunity Center is housed.
Sir, can you provide transportation?
No.
Sport
right,
train
right
does.
now, as the bus is still being free, that is the biggest mode of transportation. And we have some roadblocks still working at Southern. Like, I would love to give everyone lift rides and stuff, but it's a university policy where I can't. But I'm still being creative to try to figure out what else we can do by the time the busing service kind of ends, this next year. So,
Thank you. Thank you.
TV.
If any of your participants enrolled, if any of your participants enrolled in WIOA, we do offer transportation assistance. Unfortunately, not in the form of an actual ride, but we do mileage reimbursement.
Great.
Yes, I need your information 2 times. All right, anybody else? Jayla?
Oh, no.
Oh. Dr. Russell, Judge, what's your name? Got her name? Sims. And Jimmy Graves, we didn't get in, and Sherry, we didn't get, who didn't get in on the introductions. Dr. Russell made me promise to let you know who they are. Could you stand and introduce yourself? What organization you're with before we break up?
Just with Community Renewal, and just so great to be here. I'm director of Haven House, and of course I've got my tentacles in a lot of other areas, but that's primarily what I do every day. Here at Mount Canaan as an outreach pastor, and of course working with Voices United and a lot of other organizations to just build relationships and partnerships all over the community. The more we know each other, the better life will be.
Sherry?
I'm Sherry Brown, the Volunteer Service Project Coordinator at Community Renewal.
Hello, everybody. My name is Sheila Sims. I am the Chief Judge at Shreveport City Court. If y'all have any flyers, I'm the only judge that gives out flyers. So if you have flyers, I'll be more than happy to give them out.
Oh, nice.
All right, thank you.
I'm Jimmy Graves, Director of Development with Community Renewal. Great to see everyone.
And I am the one and only.
The one and only.
Marty.
You know one who did it once?
We had some.
No one wanted it
All right, guys, once again, right here, one more announcement.
Yes, ma'am. No, I came in after the introductions. I'm Penny Butler. I'm program manager to the City of Shreveport. I do the City of Shreveport counterpart to the WRA program, and I'm
Awesome.
Yeah, let me get this.
Okay, so outside of the city limits, inside of the city limits, the WIOA program, okay? 18 to 24. Once again, if you have not gone on on a tour, community renewal, we will host tour and we serve you lunch. See, you see the theme here? We serve you lunch. We talk about what community is, what we do. We hop on a van and we go to one of our friendship houses to show you what happens in the after-school programs there. So third Thursday of each month, we have one coming up September 19th. If you haven't been to one, jump on a bus. Let's go on a tour. Let's talk about what we do and how we can support each other right here.
I had a question. So the friendship houses when my kids have been to one, for summer, it was over the summer. The summer camp, it was Queensboro. They went to the summer camp there.
Safari Pals.
Yes,
camp.
Safari. Yeah. They went to all of them. I didn't really like so right now I have them signed up with the SPAR because they do after school. But it's in Lakeside, so it's kind of far from Highland. But the Highland has a friendship house, so you just drop your kids off or what?
We have a beautiful friendship house in Highland, right on Olive Street.
What's wrong with Prospect?
Yeah, we'll connect after this, and I can tell you everything you need to know based on, because we have a kids club and a youth club at the Highland Friendship House. So anywhere from kinder to senior year.
Yeah, this is my type of meeting. This is an Acts 2 type of meeting where there was no need left among them.
One more thing, many people here probably don't know, but most people who know me know my degree is in mathematics. I have a degree in mathematics. I used to be a high school teacher. I used to teach algebra 1, algebra 2, probability and statistics, trigonometry, and I tutored calculus on the side. But I am thinking about,
I think you should.
I'm thinking about starting a tutoring class just for algebra 1, which is my specialty, and multiplication, which is where people get lost in elementary school. Thinking it's only so many hours in a day, but if you all have a facility that I can come in and do it and have
Put your head down.
and have students there, I don't want to be inundated. The hard thing is I want to do it right after I finish work. So the problem with that is you don't know what time it is. But I can give you a general time. Because I know the problem that most people have is mathematics, and specifically algebra.
Yes.
But they miss out on the multiplication tables before. Now, I'm not teaching how to add subtract. I'm only doing, so please, if anybody not, please don't ask me to do anything else what I'm saying. Because it's only so many hours in a day, and I can't do everything. So I'm trying to start, as some of you all know, a community court and Shreveport City Court. I'm fighting that battle because there are people on my bench who don't want that to happen for the help to community. So I'm still trying to fight that battle and start this one. So please, 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 nothing other than algebra 1, not 2, just 1, and multiplication, please.
And we may be able to work around some of those time constraints. I
Yes.
can record you. We can
Oh, I like that.
We're getting ready to start up with the Educational Opportunity Center, some online high centers.
I do it all free. I do it all
I'm
free.
talking about YouTube.
Oh,
Yeah.
you
So,
know my dance?
yeah, we're using Microsoft Teams right now, but yeah, trying to work about the time. We can get that knowledge out to the students. Yes, sir.
I just want to get like a shameless picture of me in front of this group so that I can turn it into my board.
Let's get your certificate.
I like that.
I have to document everything I do.
They're doing this area of parallelograms and
They're good.
triangles.
Get one?
I thought that was like from behind.
Oh, this is good.
You want a picture with all of us in the background?
Thank you guys for gathering. You are amazing. Go out and change the world. We'll see you next month.